Within 10 seconds, we will go live to the audience and I will give countdown from here.
Tech team, once Amitabh ji's introductions, just upload the slides of introduction.
Sure, sir, sure.
Yeah.
So, sir, it's 3, 2, 1. We are live to the audience. Over to you, Amitabh, sir.
Okay. Good evening, everyone, and welcome to our webinar, Seizure Can't Stop You, under the campaign of Live Brave and Live Guarded. My name is Amitabh Pandey, Senior General Manager at Lupin, and I'm heading CNS Business. Thank you so much for joining on this important journey to raise awareness about epilepsy and seizure. Live Brave, Live Guarded is a campaign launched with the initiative to raise awareness about seizures, first aid, and support person with the epilepsy, which includes seizure first aid demonstration, video knowledge assessment module, and educational content for the person with epilepsy and caregivers. Today, we'll be discussing about the journey of Vinay Jani, celebrated that how his fitness and adherence to the anti-epileptic medication have helped him to overcoming seizures. Our esteemed panelists include, all this as far as the medical neurology fraternity is concerned, these panelists don't need introduction, but just to name and further that will be taken by detailed introduction includes Dr. Pravar Passi from Indore, Dr. Sathish Kumar V from Chennai, Dr. Anuradha HK from Bangalore, and Vinay Jani from Delhi. They all have their own records of running, and they are all of them marathoner today. Now, when we talk about running and marathoner, what we are trying to put the emphasis here that it's not about running; it's about whole lifestyle. In Kalidas, the one of the most celebrated poet the India has ever produced, in one of his book, Kumar Sambhavam have written that, Sharira Madhyam Khalu Dharma Sadhana, which means unless until you work on your body, you protect your body, you take care of your body, nothing is possible. You cannot achieve any goal. So this webinar is, of course, we are focusing on the epilepsy patient and caregivers. It passes beyond that. Throughout this webinar, we encourage you to participate actively, ask questions, and share your thoughts. Let's work together to break down the barriers and create a more inclusive and supportive community for this patient living with epilepsy. Before we begin, I want to thank you and put a lot of gratitude to our panelists, Lupin, my colleague and attendee, for making this webinar possible. Let's get started on this important conversation, and together let's make difference in the life of caregiver and particularly those who are suffering with the epilepsy. Now, I would like to hand over this session to Dr. Pradeep Mate, who is the senior manager and who is heading for some of division, including CNS, as far as the medical services are concerned, who will be the host for this webinar. So thank you once again, everyone. Thank you. Over to you, Dr. Pradeep.
Thank you, Amitabh ji, and once again, a warm welcome to all the viewers, those who are attending this webinar. And it's my privilege to give welcome to all the esteemed panelists, those who are joined today's webinar. Tech team, can you just upload the slide? Yeah. So Dr. Passi, who is the distinguished consultant neurologist and head of neurosciences at IOCI from Indore, with remarkable over 30 years of experience, and his expertise includes the management of the complex neurological disorders, which includes multiple sclerosis, Parkinson's disease, stroke, and epilepsy, and so more. As the president of Indo Neuro Society in 2023-24, he spearheads the initiatives in advancing neurological cares. So, outside the medicines, his passions for fitness is evident in his impressive feats, as he completed 3 full marathon as well as 1 ultra marathon. We welcome you, Dr. Passi. Next. Next panel is Dr. Sathish Kumar. Sir is head and senior consultant neurophysicians at Apollo Specialty Hospital, Chennai. Several years of experience managing various neurological conditions, including strokes, cerebrovascular disease, cognitive disorders, movement disorders, and epilepsy, and so on. So he has successfully mentored over 260 epilepsy surgeries, and he is the faculty as well as authors for many publications and book chapters, as a faculty for various national conference. He's also endurance runner as well as blocker. So we welcome Dr. Sathish Kumar as well as a panelist. Thank you for joining us. Yeah. Our next panel is Dr. Anuradha HK. Ma'am is consultant neurologist at Astro CMI Hospital, Bangalore, where she's experts in diagnosis as well as management of range of neurological conditions, which include stroke, epilepsy, movement disorders. So beyond her medical expertise, she is testament to her unwavering dedications and passion for fitness. As you can see, with the impressive athletic portfolio, she successfully completed over 500 half marathon and 50 full marathon, showcasing her endurance and perseverance towards the fitness and health. So we welcome you, Dr. Anuradha. So next slide. Finally, it's my privilege to welcome Mr. Vinay Jani, who is IB Golden Light Awardee, motivational speaker, epilepsy advocate, ultra-cyclist, and marathon runner. Vinay, a resident of New Delhi, was diagnosed with the focal seizure in 2005, which progressed to generalized seizure by 2008. Significantly impacted his lifestyle. However, he transformed his life through fitness. Some noble achievements of Vinay include its completing 200 kilometers of brevet cycling in 2016. He's participating in the prestigious Paris 1,200 kilometer cycling at the France, and the finishing multiple half marathons, city marathons, and national marathons championships. Vinay's inspiration journey has earned recognition from the International Bureau of Epilepsy. So in 2021, he received a esteemed prestigious Global Light Award for overcoming epilepsy-related challenges and raising awareness about these conditions and motivating others with the resilience and determinations. We welcome you, Vinay, for this panel discussions and webinar. Along with this, I also welcome Lupin Leadership Team, Mr. Amitabh Pandey, who is heading CNS division, as well as Mr. Suman Gupta, who is also taking care of marketing and sales of CNS division of Mindnex. So with this, now we'll begin and start discussions. And first of all, I would like to invite to Mr. Vinay Jani for the discussions. And to begin with him, Mr. Vinay, could you just share your experience, how your epilepsy journey so far, and how the fitness played a role in your ability to live bravely and live guarded?
Thank you, Dr. Pradeep. My journey with epilepsy began in July 2005 when I experienced a seizure while driving, which led to a serious accident. After few more seizures, I consulted a neurologist. While my EEG was normal, an MRI revealed a cyst in my left temporal region, triggering focal seizures with impaired awareness. Over time, I slipped into depression, gained weight, and wasn't consistent with my medication. And in December 2008, I had my first generalized seizure and was hospitalized. At the time of discharge, my neurologist told me that he is having two options: either increase dosage of my medications, or I should lose weight to make my current dosage effective. So that conversation was a turning point. I chose fitness and it changed everything.
Certainly, as you have mentioned, fitness, the aspects which has changed everything and which has helped you to live bravely, as well as it's guard you in your journey of epilepsy. So with this, I also would like to invite our today's panelist. From the medical standpoint of view, could you share your expert views on how exercise and physical activity can help controlling epileptic seizures? And what types of exercise or physical activities would you recommend for the epilepsy patients in your day-to-day clinical practice? So we'll begin with Dr. Passi.
Yeah, so I think here's a very important point that Vinay started off with. that first and foremost is that your weight becomes stabilized once you exercise regularly. And then there are so many other things which fall in place once you exercise. You kind of sleep better, you have a better schedule of your meals, all your entire timetable falls in place. And that also includes that you regularly take medications. Another big thing which I emphasize on regarding exercise is what people who exercise are generally the people who are taking their health more seriously than others. So they become more conscious about eating junk food, being regular with medications, and stuff like that. So it's like a small nudge exercise. It begins with a small nudge, but it has in our neurology language, I'll say it has pleiotropic effects, not just on um, weight, your mood, your sleep, your behavior, your timetable, everything improves. So you benefit on many more fronts than just the physical part of losing weight.
Yeah, thank you, Dr. Pasi. Dr. Satish would like to add.
Yeah, I completely agree with Dr. Pravar Passi, who said everything about the role of physical activity and mental health. Health is a combination of both physical and mental. As a neurologist, we always advocate mental health and physical health goes together. So everything is clearly told by Dr. Pravar Passi and Mr. Vinay that yes, exercise plays a vital role in one's personal fitness, not only in fitness, in its mental capabilities. You endure more, you can withstand all the mental psychosocial aspects of any disorders, whether it is epilepsy, stroke, dementia, and other things. So you will sleep well, your timetable sets well, and you will have a lot of endurance, resilience, mental resilience when you have a enduring physical fitness freak person. Over to you, sir.
Dr. Anuradha, I would like to comment on them. Please unmute yourself.
Yeah. So I don't think I have to add anything more. Both Dr. Pasi and Dr. Satish, they have told the same thing, that once you start exercising, you'll be more disciplined regarding everything. So once you are disciplined, you are there. You're successful and in whatever you do. So that when you are disciplined, we say like you're free. You're not bound by anything. So once you exercise, everything falls in place.
Very right. So when you exercise, everything falls in place. So it's same as true for the epilepsy patient as well. So again, I'm coming to Mr. Jani. So
I'll just ask a small thing here to Vinay. So would you say that you had good motivation, or would you say that your neurologist had good motivating powers?
Sir, yes, my neurologist has a very good motivating power, but along with this, a strong mindset also plays a very vital role.
True, true, because we tell the same thing to so many people.
Many patients, yeah.
Very few end up like Vinay did. We do this thing to almost all patients, but I think that way Vinay is a strong and determined person who could put that into practice. Kudos to that.
Thank you so much, sir.
Certainly. I'm coming to Mr. Jani again. So, Vinay, we all are aware that the social stigma is very important, not for Indian, but as globally when it comes to the epilepsy and individual who diagnosed with these epilepsy. So, with this context, how the society as well as your family member help you to overcome this stigma and come out of it, and you manage all these things?
Yes, as an athlete living with epilepsy, there have been definitely challenges, especially around training intensity, safety during long rides or runs, and sometimes public perception that epilepsy limits your capabilities. However, being open about my neurological disorder has made a huge difference. Instead of hiding it, I choose to talk about it. And it has helped me build a strong support system. I'm fortunate to have family, friends in cycling and running community who stand by me, understand my needs, and even carry my SOS medicines during events and training. This openness has not only ensured my safety, but also helped break the stigma. Thank you.
Yeah, so breaking stigma is very, very important. Any of our panelists would like to comment on how they are perceiving this social stigma in their practice and patient how they are overcoming with this stigma?
So,
Yeah, Dr. Passi.
yeah, so I think again, Vinay has come out very well on this. That he came out openly and said, "Yes, I have got epilepsy." So I think it requires a great amount of courage for somebody to say that, and I think it requires a lot of dialogue with your family and your neurologist. And by and large, your neurologist will encourage you to be open about it, because if you're open about it to your employer, to your friends, to your co-workers, they know what they might expect on a bad day and what they need to do. So I think it's very important that this message also goes through, that uh, don't shy away from saying that yes, you have epilepsy, because in the longer run you stand to benefit, because should you have a seizure at some point in time, they know what to expect and what to do. So it's a smart thing in the long run. Whereas most people would say uh, shadi ka problem hai, employment ka problem hai, those are all of course there, but overall I would say that you stand to benefit if people around you know that you sometimes might lose consciousness, and they know in that case what is to be done with you.
So certainly, yeah, Dr. Passi, the breaking the stigma is very integral part of initial management of epilepsy. And again, my next question to Dr. Passi regarding the how do you see the connections between the fitness and the outcome of epilepsy when we talk particularly in terms of seizure frequency as well as overall quality of life? How do you see this correlating the frequency and quality of life with the fitness?
Oh, I think they're absolutely inseparable. And that's what I'm saying. That's what I started off with saying, that once you start exercising, and uh, I have a small bias for running because I run, but I wouldn't say that running is the only solution. Yoga, Surya Namaskar, cycling, walking, treadmill, you do whatever, but your uh, endorphin levels are completely different in people who meditate, who exercise regularly, versus those who don't exercise regularly. And again, it is not just sleep, it is appetite. I have personally experienced, I'm a Punjabi, and Punjabis are big time foodies. We love to eat all kinds of junk food, and no food is complete with huge amounts of butter and all kinds of stuff. But once you start running, the craving for that junk food just drastically goes down. And I'm surprised. I'm still Punjabi. I still have the same genes. Same food is kept in front of me. But I just don't have that craving now. I just have a little bit of it. It's very surprising that your cravings come down, your weight becomes all right, you sleep better, your sense of humor improves, your general well being improves. So it has multitude effects rather than just being better in shape and getting six packs or stuff like that.
So certainly, so there are a lot of benefits of exercise and fitness, not only related to seizure frequency as well as to improve your quality of life and overall well-being of the epilepsy patient is concerned. My next question is to Dr. Sathish Kumar. So since a while we are talking about the more on physical fitness, exercise, and so on, but mental fitness or mental well-being of these individuals also important, because as we rightly mentioned, the stigma, the patient are taking a lot of medications and is continuously thinking next season if comes what happens and so on. So according to you, how this mental fitness is important. How to overcome this barrier of the mental challenges with when we're dealing with such kind of epilepsies and taking treatment.
True. So as we discussed with Vinay and Pravar Passi sir, epilepsy was considered as a stigma. So it's a social stigma. It's even person who are suffering from epilepsy tend to have stigma. So even in substantial progress in medical treatment and seizure control, there are reports of prejudice, bias against epilepsy. Persons living with epilepsy, the stigma plays a pivotal role not only for the society, also for the contribution of so many psychosocial factors such as people who tends to develop seizures. They have anxiety about their illness, they have depression, they have phobia about facing a normal routine life, whether it is employment, education, marriage life, and social interactions. And they have a high rate of suicidal rates too. So there are different types of stigma, whether it is felt by the patient, that's called a felt stigma, and when felt by the society, which is an enacted stigma. There are so many mechanism and factors, depends upon, as Vinay told, started from 2005 and then 2008, he had a generalized seizures. So it's about the onset of the disease, what is the frequency of the seizures, and how long he was on anti-epileptic drugs, the educational level, the income level, how the coping mechanism. He coped very well with physical education. Not only that, the family support, the partner, the social support are important, because even in the era of 2025, people who have active epilepsy are being considered as possessed by evil spirits and divine wrath of God. They say that you cannot study, you cannot go to school, you cannot get employed, you can't get married, you can't have a near normal productive life. So there are so many factors play a role. So there is a reciprocal bidirectional relationship between mental health and as well as the stamina. I think psychosocial problems related to epilepsy also holds true. That's why the language what we use, we don't call anymore epileptic patients. We call persons with epilepsy. The mere word persons with epilepsy indicates that you should not give a mental stigma to the patients. To break the cycle, it's crucial to understand, yes, there is a stigma, and then we have to mitigate the stigma by understanding the psychosocial factors. So as a neurologist, we should ask each and every patient, are you anxious, depressed about your disease? Do you have any other underlying depression, comorbid conditions where you can add medication, seek support? So it is highly recommended that there should be future projects and study about not only treating with medications. There are lots of programs to evolve, physical programs like physical fitness, proper diet we described, proper sleep, management of seizure includes stress management per se. So this is for the physical point of view. The mental resilience comes with what Dr. Pravar Passi sir said about you do any physical activity, it improves the mental stamina, like meditation, yoga, stress management. And sometimes if they are really depressed, really anxious, you go for some, address the issue by cognitive therapy, cognitive behavioral therapy, so that you educate them how to go ahead. Not only that, there are a lot of support groups. So the society plays a vital role in improving the mental stamina of persons with epilepsy, like a support program like epilepsy support program in each and every center, the community program, and other things. And what the platform we are today speaks a lot about, how to improve the mental resilience of persons with epilepsy. I think a lot of audiences will get benefited with how this discussion goes very well in improving the mental resilience.
Certainly. So mental fitness has its prime importance in overall management of epilepsy, as you emphasizes on. So my next question is to Dr. Anuradha. Doctor, we know you have faced significant challenges during COVID-19 pandemic, and could you share your story, how you cope up with these difficult times and how you fighter mindsets help you to through it?
So, as everybody else, even I was thinking that I will not get COVID-19. Like all of us thought that, no, I'm not going to get it, kind of thing. Then when I had it, as everyone else, it was a shock. Like, how can I get it? I'm so fit, kind of thing. So I had taken this 100 days of running some challenge. So I was on 84th day or something like that. And I got admitted, and first 2 days I was fine. Minimum 2 kilometers of walk or something had to be done. So I did it inside the hospital itself. So on third day, I couldn't walk. I just could not walk for even 50 meters. My saturations were dropping. I think that's when it hit me that, I think, I've got pneumonia. Then after that, even speaking was difficult for 10 days. So I had to take steroids and stuff. Then by 10th, 11th day, then I started becoming better. I got discharged. But after discharge, more than physical health, I faced this episode of anxiety. So I didn't know how anxiety feels. As a personality, I'm not at all. Um, I'm I'm not an anxious person as such. So uh, I was wearing my watch and I see my heart rate going up to. Otherwise, my resting heart rate would be around 60, at that time 60, 65. So my heart rate was going up to 170, 180, and I could feel that palpitations for the first time. That was quite scary and first time in my life. And I was thinking whether it is because of COVID pneumonia or whether it was psychological or it was organic. Then on day one, I took an anti-anxiety. And from that, when I took an anti-anxiety, I decided this is the last medication I'm going to take. I'm not going to be anxious, come what may. So, and because my mental strength was good because of the exercise, my physical strength, my lung capacity was good, I started improving better. That's what I keep telling my patients also. See, a lot of people develop diabetes when they took that large dose of steroids, or even their blood sugar went high. My blood sugar never went beyond normal. These are the benefits, and you recover fast. When you have an illness, it's not like you will not develop any illness. You will develop, but you will have more strength to deal with it, and you will recover quicker than people who don't exercise. And I think this happened in September. In January, I did my 12-hour stadium run, where I clocked around 90 plus kilometers. Only for the first 6 weeks, like till October, I did not run because COVID had its own issues, and I was also on anticoagulation for a couple of weeks. So I didn't want to fall and get into trouble. But after that, I think it was as though I completely forgot that I had COVID. So after that, a lot of patients came and kept telling me that I had COVID, I had COVID. That's when I used to remember, oh, even I had COVID. So I feel it's all here. So once this is set right, everything falls in place.
Yeah, very well said. So everything is in your mind, and in this unprecedented time of COVID-19, which impacted the overall the mental as well as physical health of many individuals, and hopefully the word has come out of all these things now. So move on with this. Now again, I am asking these questions to. This is a very important question, Dr. Satish. So diet and sleep. It's very integral part of any disease regimen. How do you see this in a management of epilepsy? What do you recommend to your patients, and how important is uh, to moderate these things, diet as well as sleep?
Yeah, it's a wonderful question. I think for every health, including our fitness journey and mental health, you need these two vital pillars of health. I think they play a major, indispensable role in maintaining health in any illness. I personally feel that sleep has a direct correlation because when you don't sleep well, sleep deprivation triggers more and more of seizure. The first question in any patient who comes with relapse of seizure, the first question you ask is, did you take the medication? Did you sleep well? I think there is a complex bidirectional relationship between sleep disorders and as well as epilepsy. We all know that during different stages of sleep, the seizures tends to become more and more, and as a neurologist, we also know there are so many epilepsy syndromes happens in sleep. Decreased sleep has effect on the sleep sleep and epilepsy. What we should also know that the comorbid conditions in persons with epilepsy. So there are a lot of sleep disorders happening which we don't address. We just ask, are you sleeping well? Sometimes they have anxiety and depression due to their mental psychosocial aspects. Sometimes they can't sleep well. They have insomnia. And so many drugs we give for the seizures also have an effect on the sleep quality cycle. And not only that, majority of the people are unfit. They have obese, and they tend to have snoring in the sleep. And these people, if you really address by doing a proper referral to a sleep specialist, if they do a sleep study, they will find that they have snoring in sleep. And if you correct the snoring by giving a positive pressure airway, not only the sleep quality improves, the seizure burden comes down. So you may not even increase the seizure medications if you ask the patient to sleep properly. So that has a direct correlation. So identifying the sleep problems, sleep plays a vital role in the management of difficult to treat epilepsy. Diet, yes, I agree that every one of us agree that a proper balanced diet includes a healthy combination of all the uh, carbohydrates, proteins, and fats. In the fitness journey, we also look for more and more proteins. In considering epilepsy per se, as epileptologist and the neurologist, we always talk about one thing called high ketogenic diet, which has a role in play in epilepsy, in difficult to treat epilepsy. For example, there are so many children and so many kids who have daily seizures with developmental dysfunction where they cannot develop clinically well because of continuous seizures. In these types of disorders, we tend to give diet called a ketogenic diet, which is freely available in our country, where it improves the quality of health, reducing the seizure burden. Not only that, a proper balanced diet is important to maintain epilepsy. Take medications, sleep well, and take an adequate diet. This is vital for each and every person with epilepsy.
Thank you. Thank you so much. Now I'm again coming to Mr. Vinay Jani. So, Vinay, as an athlete living with epilepsy, have you faced any specific challenges when it comes to training or competitions or even a public perceptions? And have you navigated those hurdles in your this athlete journey as well? You on mute.
My openness about epilepsy has helped me a lot. Accomplishing so many things in life. So initially, if I talk about stigma, it was like my own personal stigma. But when I moved on, I got a good support for this.
Yeah. Thank you. My next question is to Dr. Passi. Fortunately, in India, the persons who suffers with any disease elements has very good supports from their caregivers and family members. How do you see the supports of family, friends, and community play a role in overall treatment and management of the persons with epilepsy?
So I think first thing one needs to do is to accept that you have a small issue, and you have to tell them that there is an issue. You can't live in denial. The issue is real, and the issue is there. And I have worked out a nice way around it. I uh, crack a joke on myself and say, "Look here, I am become so bored. So there is really nothing much that I can do about it. And I look so old. And often when I go out with my wife, she is mistaken as my daughter. So I just uh, play that joke around, and that is what helps me uh, uh, ease the whole conversation. So first thing is accepting that there is an issue, then becoming open about it. That yes, let people know it. It's not something uh, which has happened. It's not like cirrhosis, which has happened because of alcoholism, or have not become HIV positive because of promiscuous behavior. It has happened because of some reasons which are really outside my control. So first thing is to be open about it, then to understand that it's not because of some faulty thing, which most often it's not because of something fault which you've done, something wrong which you've done. And then to reassure these people and tell them that, look here, in medicine we have solid medications, we have surgeries for you, we have investigations for you, we have support groups for you. It's no longer what it was 50 years back, 40 years back. And you can lead a almost normal life. Okay, you can't become a pilot, you can't do some crazy things, but having said that, you can do pretty much almost all of them. And I give this example of Jaunty Rhodes, who is an epileptic, and I just tell them that I just tell them in Hindi, अगर कोई catch Jaunty Rhodes से छूट गया है, तो मतलब वो catch था ही नहीं. He can lead that normal a life. So who are you? Who are nothing? So encouraging them and encouraging them to be open about it and telling them that, look here, we've got lovely medicines, we've got lovely procedures for you, we've got some devices now which we can implant. So there's a lot more to offer now than it was ever before in the history of medicine. So that kind of also puts the thing in place, and they realize, oh yes, life is not that bad. And once most of these the biggest religion in India is cricket. So almost all of them have heard about Jaunty Rhodes, and they kind of immediately say, oh wow, he has it. So no, cool. So it's not so bad.
Yeah, certainly, sir. So make them understand and accept, make them accept the reality, as well as to make them understand they are not the only alone. They are suffering with this, and certainly the family and relatives' roles is unique and important. Now I'm coming to
Just one more. I also tell them,
yeah,
somehow in India, everything is a stigma. Depression is a stigma, diabetes is a stigma, epilepsy is a stigma, piles is a stigma. Everything is a stigma here. So don't play around to this gallery which stigmatizes everything. You have a problem, address it head on and solve it. And I'll hold your hand for that.
Yeah, certainly, absolutely. And next, my questions to Dr. Anuradha is regarding the topic of when we talk about the woman with epilepsy is often faces unique challenges, and particularly related to their hormonal changes, pregnancies, and reproductive health. Could you share your expert insights on how epilepsy affects the woman differently, and what specific consideration should one keep in mind while managing those conditions?
So how it affects women differently. The only the difference I see is in childbearing age group, or when the women becomes pregnant. Otherwise, I don't see much difference. I always tell my patients, first thing they come here is, Madam, ladki hai. So what? What if it was a boy? Nothing would have changed much, except that during pregnancy you have to manage in a little different way. Otherwise, we have better medications now. Even that is not a big thing. But other than that, I don't see any difference between a woman having an epilepsy and a man having an epilepsy. The only thing is that you need to be careful while choosing certain medications, so that you don't affect their during their reproductive age group. And breastfeeding. Other than that, there is nothing much. Again, as Sir said, it's more of a stigma that you don't get married, you don't get you'll have problem during delivery. And there's also a stigma that if somebody is epileptic, then you can't have a normal delivery, you will have to get a cesarean section, you can't breastfeed. All these things are completely myths. So nowadays, I think it is better. As if you see 10-15 years back and now, it is far better. We are progressing, but still that is there, where they come and tell you that ladki hai and all that. But since we have very good medications now, I don't think it's a challenge treating a woman with epilepsy anymore.
Yeah, very importantly, you emphasize and spot on this important integral point, ma'am. So all the viewers, for you, don't differentiate between women's and men epilepsy. So can be treatable, and there is as such no challenge. That is the
Don't
whole
differentiate between a woman and a man other than a physiological differences, or the physical differences. Otherwise, cerebral, no difference.
Exactly. So with this again, I am coming to Mr. Vinay Jani. So question 2 is in a spirit of live brave and live guarded message, and what advice you would like to give to someone who newly diagnosed with epilepsy and who is struggling to balance their health and their personal and professional goals?
To anyone newly diagnosed with epilepsy, first, know that you are not alone and your diagnosis does not define your potential. It's natural to feel overwhelmed, but the key is to take one step at a time. Focus on the basics like taking medications regularly, prioritizing sleep, eating mindfully, and listening to your body. These small, consistent actions can have a big impact. At the same time, don't let go your personal and professional dreams. You may need to do some adjustments, but your goals are still very much within reach. I've learned that when you live guarded with awareness and discipline, you gain the strength to live brave and push forward. Surround yourself with supportive people, stay informed, and most importantly, believe in yourself.
Definitely, believing yourself is very important things, and you are not only one that's suffering with these things. There are so many others, and this can be a change or can be managed. The well advanced treatment is there. Uh, Experts are there in India to manage those conditions. So these are the message Dr. Mr. Vinay would like to share with us. So now, uh, in the beginning, in the introductions, we have mentions our panelists has hardcore runners, athlete, marathon runner, and so on. So this is my question to all the panelists. In professional life, clinicians who involved in the physical activity, how you have balance between your family as well as professional life and keep your hobby alive and your passion alive. We start with Dr. Pasi.
So I think once you understand the importance of fitness, then automatically you take out time for it. It's just question of people don't see how important it is, and maybe we as doctors are failing in our duty by not explaining it to patients that how important physical fitness is. It's so much easier to write a pill and have that patient out of the room, and already 20 patients are waiting, rather than tell them something about exercise and eating well and sleeping well. And the patient's reaction is usually कि ये तो ज्ञान बांट रहे हैं, ये तो वैसे ही हमको फ्री में ज्ञान मिल रहा था, तो क्यों ज्ञान बांट रहे हैं, and stuff like that. So the thing is, as doctors, we need to understand that it's your responsibility to emphasize on that part. Once you start emphasizing it to people, you're also auto hypnotizing yourself. And I've noticed this in myself, that ever since I have started kind of prescribing exercise, somehow I have become more regular in it. Earlier, I would say, okay, let's have a cheat day or stuff like that. Now there is no cheat day at all, and it's all happening naturally. So once you emphasize the importance of it, after that you don't have to motivate anybody. You just have to. It happens automatically, and you know that if you don't exercise, it's the after that it's all physics. You exercise, you will lose weight. You don't exercise and continue watching Netflix, you're going to gain weight. You will have stiff muscles. After that, it's all one thing leading to another. You don't even have to convince anybody after that.
Dr. Anuradha, ma'am.
Yeah. So it's all about your priorities. So taking time, you said, it's all about your priorities. Maybe, you'll have to skip your, as sir said, you'll have to leave your Netflix, or you have to, let go your parties in the late night parties or whatever. So you have to sleep early to get up early. That's the only time we get that we can exercise. And, we can take care of our health. And if we exercise, we will be sane. And as sir said, we can advocate it. I remember as a child seeing some doctors with belly pot sitting like this, and they'll say, you have to exercise, you have to. Who will listen? Nowadays, though, absolutely not. If you sit like that and you tell that you lose weight, you diet, you do this, nobody will listen to you. They will see you and they'll say whether, what is this man or this lady is talking about when she is weighing 100 kilos. So, and also the way with conviction you can tell that do this is possible. You have to do this, and this will work out. Only if you do it, you will have that conviction to tell someone. And as Sir said, all of us as doctors, it's our responsibility to move towards wellness, not just, going on or going behind illness. Prevention is much, much more important, which we are neglecting. So
Certainly.
lot of people unfortunately have no clue about, people who come to us with diabetic neuropathies. They have no clue about what they're doing. They say, I don't eat. What they mean is they don't eat right. They don't know what is eating right. So I think until and unless we do it, it is very difficult for us to tell someone. So prioritize. You can skip a lot of other things and make exercise your priority. Then time is there with everyone.
Certainly. So moving toward the illness is required time and efforts and dedicated efforts.
I mean, see, as a female, I have to take care of not just my profession, at family also, children and everyone. So time is there for everything. I'm a hands-on mom, so time is there. So we cannot say that there is no time. You just have to prioritize.
Yeah, Dr. Satish.
Yeah, so nothing more to add. I think we agree with Dr. Passi, Dr. Anu and Vinay. So I think you need to understand whether you are capable of doing certain things good for you, number one. So before that, before you enter into the fitness journey, everyone has a start. Before that, nobody knows that you can run for such a long distances that improves your physical fit, stamina, resilience, mental resilience. So once you identified that spot, you are never gonna lose that. So it's become an addiction, and then it's habit forming, and then it is contagious, and you inspire many people, not only your patients, your family members, your colleagues, your well-wisher, whoever it is. So if you don't do your post for a week, they will come and text you, are you okay, are you ill, all those things. So it's become like a networking and cycle. So as Anuradha told, it's moving towards preventive neurology, preventive disorder. So I think in majority of our age groups we see in our outpatient, we ask them to do a basic things like you walk on certain basic maneuver, sit and stand. They can't able to do that. They will blame for so many reasons that I have done cesarean, they have done knee surgery and other things. I think everybody should know that basic maintaining the shape, basic activities of daily living are important to do on their own. Physical fitness plays a vital role in maintaining their shape, maintaining their mental health and other things. So people are forgotten because of the advent of so much technology and so much fast moving cars and escalators and lifts and all. People are not fit nowadays. Yes.
Yeah. So a lot of many questions popping up since we open the chat box now, and I'll take some few relevant questions. One question is strength training, weightlifting exercise. Does it increases or triggers the epilepsy seizures? Or what exercise should I need to avoid or ask need to avoid this exercise? So Dr. Satish?
What exercise you need to avoid, is it so? So
Yeah.
I think if you have active problems like any health problems, you will understand slowly that whether it is triggering your disorder, whether it is sleep disturbances or seizure or whatever. I think as a patient, if you have a real problems in physical activity, then do it in moderation. Start slow, build it up nicely. Take the help of peer groups. even with people like Dr. Passi sir was telling, John D. Rhodes was an active cricketer, so he never had problems in maintaining endurance sports in the field because there is tend to have injuries. So even high velocity sports like you can still do. But I think certain hobbies like driving your car. As a neurologist, we tend to say that don't drive when you are having active epilepsy. But otherwise, I think any form of sports are good in majority of the cases. So high velocity contact sports, better be careful. Anybody can add anything if they have something in mind.
Yeah.
Dr. Passi and Dr. Anu.
Dr. Passi?
Yeah, I fully agree. I mean, there's a small concern of patients exercising and hyperventilating and precipitating a seizure, but that's a very small risk, and you should discuss with your neurologist. It's a one-on-one conversation, and your neurologist will talk to you through this. But overwhelmingly, the answer is go ahead and exercise, because the overwhelming benefits are far, far more of exercising rather than just being sedentary or a couch potato or whatever. From fits to fitness.
Yes. Start slow. If you have never done that, start slow. Identify your capabilities and then build it up.
So we are getting many comments from all across India as well as few comments from Abu Dhabi as well for appreciation of this session. I would like to read one such comment. Sanjana from Mumbai saying that glad to see the neurologists engaging in such holistic conversation talk, which is beyond medicines and it builds a lot of trust in patients like me. So thank you, Sanjana, for sharing your thoughts and comments. Now again, we'll move to Mr. Vinay. You'll agree with me that it is equally important to have sufficient sleep, as Dr. Satish mentioned in his comments. And apart from your diet and medications, how you manage your sleep, food, and medicines to have a right balance of it?
Yes, sleep is very much required. See, I being a endurance athlete, I have to wake up 4 in the morning. So I have to maintain a daily schedule. I have to make a discipline that I have to sleep latest by 9:30 so that I can have a sound sleep. My brain can relax, and next day I can go out for a workout. So yes, sleep matters a lot. Along with this, maintaining a healthy diet, taking anti-seizures medicines on time, these are very much required for PWs.
Right. Dr. Pasi and Dr. Anuradha, next questions to you is it's from Mr. Raghu from Ahmedabad. He's saying that what should family members or friends should know about the supporting someone who is with epilepsy and who is very much active in sport? So, what precautionary measures they will be taking as a caregiver of that particular children?
Anuradha?
Sir. So it's about children or anyone?
It's children. They are talking about the active in sports and the children's.
Understood. So I think it's majorly sleep and regularity with medications. I think these two should be taken care. Rest, I don't think you need to worry. But children, the most important thing is they don't realize the importance of sleep. So, there are days when they want to just hang out or watch something on the TV or whatever. So if you are in sports, I'm sure any sports you have to get up at 4:30 in the morning. So if you have to get up 4:30 for children, they have to go to bed by 8. So you have to make sure that they sleep well and take their medications regularly. Other than that, it is not of any concern. And if it comes to swimming, then I think we need to be very watchful, and the coaches need to know that such and such a child is having a problem. And most of the pools where they coach is nowadays in India at least is 4-5 feet, nothing beyond it. So it's fine. because there are a lot of people who are swimming, and even if something happens, you can always help it out. But they should be aware. The coaches need to be aware that child is having. But other sports, I don't think it's worrisome.
Dr. Passi?
So I would say that if your epilepsy is well controlled, then pretty much you don't need to worry at all.
Yeah.
Suppose you have uncontrolled seizures and you're having like maybe a seizure every alternate day or stuff like that. If your seizures are uncontrolled, then you require supervision, whether you're playing or you're alone or something like that. But by and large, well-controlled seizures, I don't try to make a big issue out of it. I just tell them it's better to lead a normal life. And if you're on the other spectrum, that your seizures are too frequent, then obviously you require some kind of supervision. But it's important to reassure them that try and lead a as normal life as possible. That includes sports and games, because it's often the case that the patient has seizures, the whole family members, the spouse, they're very, very hyper about it. They make a big issue and they scare the hell out of the patient, and the patient gets more scared about it, and it all becomes a very vicious circle. So it's important that you reassure them that by and large seizures are well controlled. So you go ahead and do your football or running or walking or gym. You can go ahead and do that. There isn't much of a big deal about it.
So I can see many questions on the diet. So I can sum up the few of questions that which diet need to avoid for the person with epilepsy. Yeah. So Dr. Passi, if you can take this question.
No, so of course, this is again broadly, there is nothing that I need to comment about diet. Just eat the common sense healthy things. There's nothing special for you. Once in a while, if you're a teenager, you're a kid, you will go on these Swiggy and Zomato apps and you are going to order that. So lead that. That's all right once in a while. So there is nothing special about the diet that I need to do. Of course, about other things like smoking is a big no, weed is a big no, vaping, e-cigarettes, hookah, shisha, all these things are getting invented as I speak. And those are the things which are a big no. Otherwise, I let them indulge once in a while. Once in a while, you want to have a pizza, it's all right. As long as you burn it off by doing a little more exercise on subsequent days. Otherwise, I don't make a big issue of diet for them. That's the 2 cents advice from my side.
Yeah. Dr. Vinay Jani, Mr. Vinay Jani, would like to emphasize any point you have mentioned in comments?
Yeah, nowadays there are many mobile applications and even smartwatches. They give live location to our caregiver. So if we are going out for some sports activity alone, so they can track us anytime. Even we can use that WhatsApp live location.
Yeah. That is also good ideas to locate particularly where they are actually is and all. So I think more than 60 minutes is over, and very engaging discussions among the panelists as well as Mr. Vinay Jani. A lot of questions, a lot of appreciation I can see on chat box. But before we conclude the sessions, I would like to invite my Lupin colleague, Mr. Suman Gupta, to say a vote of thanks to each one of you. So over to you, Mr. Suman Gupta.
Thank you, Dr. Pradeep. We have come to the end of this very, very interesting session. Rather, our endeavor to bring the experts, and the experts who are all fitness freak, I would say they are the benchmarks of fitness, with Vinay, to you on this very necessary topic, seizures can't stop you. At the very outset of this vote of thanks, I would like to thank our esteemed panelists for their insightful participation, namely Dr. Pravar Passi, whom I know personally has been a fitness freak, has been running, and his words has been so meaningful when he talked about weight, exercise. I like that phrase when you said fits to fitness. Absolutely perfect. Dr. Sathish Kumar sir, thank you so much for your presence and your insightful. Always you have been very, very meaningfully present. Dr. Anuradha, I think you have inspired by saying that fitness is not limited to the athlete only. It is for the professionals, and prioritize is one of the most important part. Thank you so much for making the program meaningful for all those who have attended, and we will ensure the learnings will be shared with those who could not attend. A special thanks to our celebrated epilepsy awareness advocate, Mr. Vinay Jani. I'm sure his real life experiences has enlightened today's discussion, and his journey has and will be inspiring many. A respectful thank to our head, our own head of Lupin CNS, our very own senior general manager, Mr. Amitabh Pandey, who has been driving the force, who has been our driving force for all our initiatives. Thanks to our evening compare, Dr. Pradeep Mate, our senior medical advisor of Lupin, for connecting all the experts and ensuring the correct flow of the discussions. With this, I would also like to thank Dr. Kunal Sunavane and the entire medical team, who has been hugely supportive for all the medical inputs. Special thanks to our marketing head, Mr. Swanand Thorat, for conceptualizing this program and driving it relentlessly through his team. And one of his team member, a special mention to the lady behind the show, Ms. Vanshika Goel, for ensuring seamless execution. Thanks, Vanshika. Thanks to the Imagika team for platform and its coordination. Thanks to the entire Lupin MindNext field managers and executives who have tirelessly tried to make this program reach to all the corners of the country where it would matter. And thanks to all the healthcare professionals who have taken out time and shown importance to this topic by attending it. What I could see is that approximately more than 1,000 people have attended. At the end, I, on behalf of entire Lupin CNS, would reiterate that we are committed to bring many such initiatives which not only focus on controlling epilepsy, but also ensures how to live bravely with it. So next time when we say, live brave, live guarded, please remember we are trying to put commitments to actions. Thank you and good night.
Thank you.
Thank you so much, and thank you everybody.
Thank you, everyone. Good night.
Good night.
Thank you. Bye.
Bye.
Bye.